It involves collecting information from the patient and their families or carers about their condition and perceived problems. In the OSCE assessment, you will be marked on your abilities to assess a patient's nursing problems accurately, your clarity on verbal and non-verbal communication, your ability to establish rapport with the service user or patient. The Royal Marsden 9th edition says, assessment is the systematic and continuous collection, organization, validation, and documentation of information. It is a deliberate and interactive process that underpins every aspect of nursing care. It is a process by which the nurse and patient together identify needs and concerns. It is seen as the cornerstone of individualized care, a way in which the uniqueness of each patient can be recognized and considered in the care process. You must demonstrate excellent listening skills and respond to their problems or concerns. Also, clarify and check information and summarize your understanding. Listen and pay attention carefully when the examiner is introducing the station to you, or you may miss some vital information. Use a pre-filled admission form to help provide you with a structured and systematic approach to assessment. Take the patient's clinical observations and record them on a National Early Warning Score, NEWS, or Glasgow Coma Scale, GCS, chart within 15 minutes to pass. Hamilton and Price 2013 state that assessment is the cornerstone in establishing the needs of the patient. They say that if done effectively, it leads to the nursing process being a success. Or utilize the already completed PHQ-9 score and escalate appropriately. The Royal Marsden Manual of Clinical Nursing Procedures 9th edition is the publication all nurses are referred to as the standard for clinical practices for nurses preparing for the OSCE. It does contain sections on API as well, and it is essential reading in preparing for the OSCE. Assessment forms an integral part of patient care and is considered to be the first step in the process of individualized nursing care. It provides information that is critical to the development of a plan of action that enhances personal health status. Assessment decreases the potential for or the severity of chronic conditions and helps the individual to gain control over their health through self-care. RCN 118. Early and continued assessments are vital to the success of the management of patient care. It is critical that nurses have ability to assess patients and document their findings in a systematic way. Information gathered can be either subjective or objective, primary or secondary. Subjective information can be when a patient tells you how they are feeling, levels and sensation of pain, and is open to interpretation. You must, however, always accept what the patient is telling you as being the truth. Objective information is that which can be measured, such as blood pressure or weight. Primary information is gained from the patients themselves, while secondary data comes from other sources, such as family members. Use the scenario given as a handover and the admission booklet to gain a greater ability and vulnerabilities. With the initial information, you have a good starting point on how to approach the patient. You may identify factors such as disabilities, pre-existing health and mental health issues. As you approach the patient, without speaking, you will observe them for outward signs, either positive or negative. This can be done very quickly on first seeing the patient. Look for signs of pain, discomfort. Are they sitting up or hunched over, breathing rapidly, or do they appear drowsy? An assessment of patient's airway, breathing, and circulation is always the priority performed immediately. Once these three areas have been assessed as being stable, then the more informal assessment can take place.